Thanks, Effie. Some of you have heard most of this before, but I'll try and give you an update. So some of you have noticed our Simons Searchlight table outside. This is an update for the data that's coming from that. This is something that we have open to families around the world, and for this, we have a chapter for CTNNB1. And as we're doing this, I want to be clear that this is a living research study, so it's not a one and done and walk away. We're trying to understand people over the life course, and as we do this, I'll get into why that's important. But I do think challenges differ when you're 3 than when you're 13 than when you're 23 or 33. And so we're trying to understand that, and we will be with you in terms of understanding that over the entire life course. This is something that some people have been concerned in terms of what happens with your data. So the data are all de-identified, so no one knows your name of who you are, but we make this freely available to researchers around the world. And when I say researchers, I mean people at universities. I also mean people at companies that might be working for treatments for you. So in doing this, we make sure that they're qualified researchers. They're good people who should be doing research with your data. Again, it's stripped of your information, but we want to make it available to as many people as possible. We want to multiply the effect of your investment for that. This is just an example of the publications that have come out using your data so that you can see that people really are using your information. And in doing this, certainly reach out to any of those folks in terms of being able to explain what they've learned with you on this journey. So now here are your data. So as we've done this, for those of you who may have feeling like you're gotten stuck or you're not sure if you should be doing something else, again, the team outside, the Searchlight team, will help you to get unstuck or to be able to help you navigate. In doing this, we've had almost 300 people actually register in terms of interest. And then we do a really good job, I think, of verifying that people really do have the diagnosis by sharing their genetic test report, and then we do a verification. And I'll show you what the genetic results have been. But that's why that number goes from about 300 or 296 down a few less than that to 238 that have a verified genetic diagnosis, and then the numbers downstream of who do the different activities, including the blood sample, which is an optional thing, which allows us to make induced pluripotential stem cells, actually at great expense to the Simons Foundation, but to be able to do that, to then have cells that the community can do, the research community can use, and again, those are freely available from the Simons Foundation. For those of you who are interested, this is just a stick figure of the gene and showing all the different variations that we see within the gene. We think they act at a molecular level very similarly, so that even though you might be a onesie, you're the only person within one particular genetic variation, we think the way it actually acts is probably similar, although you see in this sort of skyscraper-y view, there are particular places where there's more than one person, unrelated. Not that you're related way, way back, completely unrelated, but you share the same genetic variation. And over time, if we identify that there's something unique about that, we'll certainly let you guys figure that out and connect with each other. It's an international registry, so although we've got a lot of people in the United States, and obviously we're in the United States today, it is meant to be around the world, and we have many, many different languages to be able to support people around the world to do that. Okay, so show me the data. This is an important fact that I want to make sure limits what we understand about the condition. This is the age distribution, and it's not just the age distribution of who's in Simons Searchlight, it's the age distribution, I think, reflective of who knows their diagnosis. Not to say there aren't people that go across the age spectrum that have the diagnosis, but if you don't access the genetic testing, then you don't end up in this community, in this room with CTNNB1. So, what are the limitations? The vast majority of individuals are still young, still less than the age of 10. And so when people come to me and say, what will life look like when I'm 30 or 40? I have a lot of limitations in what I can say because I don't see people who are 30 or 40 on this graph, right? And so that's one of the things collectively, if we can think about how do we get access to individuals who may be older, I'm certainly happy to provide access to testing, make sure they can get their diagnosis, whether it's CTNNB1 or something else. But within this, that helps us in terms of understanding. So limitation in terms of everything else I'm going to say. So what is it that we see? Not surprisingly, it's a lot about the brain and behavior, right? This is primarily a brain, a neurological condition. And as we see this and as we think about the manifestations, you know this, you've seen this, you've heard from others today. It's mostly around things in terms of processing, in terms of how we get the brain to move the body, the coordination, whether it's speech, whether it's coordination, whether it's gross motor skills or big skills or fine motor skills, all of those those things we can see. And not everyone, but we do see, as you heard before, also some other diagnoses, whether it's ADHD, whether it's epilepsy, whether it's autism, but we do see some of these other diagnoses. But everyone has something. Some people have dual diagnoses, some people have 3 diagnoses, but everyone has something. As we think about this, the next most common thing that we see are the eyes. And this is actually one of the, I think, distinguishing features for CTNNB1, and one of the important ones is I would say all of you need to make sure, and I think you have, but based on the show of hands earlier, seen a neurologist, developmental pediatrician, but also ophthalmologist is one of the things that I didn't hear a survey of that I think we need to make sure people do, because there can be, the eyes are actually the way information is coming into the brain, and so we need to make sure all of those sort of highways are getting good information into the brain, that people are safe because they can see, and that's one of the things I'd say we need to continue understanding that over the life course. I'm just going to put that out there and understand how those things might change, because I am not concerned like worried, but I do think we need to make sure we're literally keeping an eye on that as we go forward. I'll talk more about the specific surgeries, but one of the ones is with a tethered cord specifically, another thing that's a little more common within this community that we need to do. And as we've understood and learned together, we've tailored what we've been doing in Simons Searchlight to make sure we're collecting the right data that's customized for your community. Good news is, so far, we have not been seeing what do you not see on this list, and again, with the limitation that these are young people, but it's good. I'm not seeing things like cancer. I'm not seeing things like an extra amount of diabetes. I'm not seeing that there are a lot of autoimmune diseases. There are a lot of things that I'm not seeing on this list that I would call regular medical issues. And so in a good way, again, with the limitation that we're still young as a community, I'm not seeing a lot of other complicating things, which actually is good news for me. It does mean that we still have the everyday things that any child or any young person can have in terms of health issues, but mostly what I'm seeing, again, is brain and behavior. I'll point out another thing, although we do see seizures, and I'll get into that a little bit more, we don't see a massive percentage of individuals with seizures. And so again, and I'll get to that in a little bit more detail, but that's one important thing that I do think is important to recognize and diagnose if we see it, but we're not seeing an excessive amount of it. Within the endocrine line, that light blue line that you see there, mostly that's related to growth. So it's not related to diabetes, hypothyroidism, other glandular disease. That's mostly representing growth issues in terms of being a little bit shorter, a little bit more difficulty in terms of gaining weight. And the gaining weight also, I would say, the gastrointestinal issues are the issues in terms of constipation. I think of these as motility problems. So in the same way that we have muscle problems, hypertonia, that same innervation or nerves that come into the gut make things flow through the gut in an abnormal way. And so I think that's structurally, it's not that there are problems in terms of the gut, but from a functional point of view in terms of how things contract and move along, that's where we're seeing the issues. Again, getting down to some of the neurological issues, you can see that we do have up at the top the tethered cord. We certainly have individuals in terms of movement problems. We do have individuals who are problems in terms of coordination issues, dystonia, hypertonia, hypotonia, all of those. And different doctors have diagnosed these in different ways. So cerebral palsy is oftentimes, I know many of you know, this is actually genetically one of the most common causes of cerebral palsy. And again, I don't think it's hypoxic ischemic encephalopathy or not enough oxygen to the brain as a newborn. I think it's really the CTNNB1 that's driving that. Seizures, as I said, the good news to me is although there are bars here, we do see seizures. We're not seeing massive bars in terms of how frequently we're seeing these, but importantly, we're seeing all different types of seizures. So it's not just one characteristic type. And if you're seeing anything that looks like a movement problem, if you're seeing your child zoning out, if there's something, eye twitching, something you're concerned about, my advice is see your neurologist. If you can, take a video to be able to share with them so they see what you're seeing. And if they need to, they'll do an electroencephalogram, not just the short ones that we're doing here, but they'll do a real true clinical electroencephalogram and let you know whether or not that really is a seizure. Within this, the other thing that people often ask me about is, well, can I know that I'm out of the window, like I'm all clear in terms of a seizure likelihood? The good news is that I think that as we're seeing these, we tend to see these within the first few years of life. So by kindergarten, as an example, if you haven't had a seizure, as far as we can tell, it's not a high likelihood that you're going to be having having a seizure later. I think if we're going to see it, we're going to see it early. Now, I'm never going to say never, so I'm not going to say that there might, again, we're still a young community, whether or not there's a risk in terms of later. Are we seeing this just because we're young and we don't know what happens all through puberty? We don't know what happens when people are 30, but so far it looks like if we're going to see it, we're going to see it when people are young. Within this, as we see going forward, most people are able to be treated with medicines, and for the most part, they're able to be treated by one medicine. And I'll get to which medicines in a second for anyone who's interested. This is what I meant by the eyes. So the eyes, the rainbow of colors here, or what concerns me, and there's not just one particular eye condition. There may be a number of different eye conditions, some of which you can see just by looking at your children, seeing if they've got cross eyes or a lazy eye. That one's relatively easy to see, but our kids can't often report to us what they're seeing. And I still remember in terms of my son, when we got him glasses for the first time, he was like, wow, those leaves on the trees look different than I imagined, right? Like if you don't know any differently in terms of how the world looks to you, how would you know the difference? So just be sure and look for those. The orthopedic issues, as I said, scoliosis, I'll just put up the reminder, especially as kids are going through puberty, make sure that we don't have problems with curvature of the spine. And as I said, endocrinological issues are largely to growth. And I'm speeding through this because I don't have much time. In a good way, the heart's not so much an issue. And in terms of surgeries, a lot of regular kid stuff. Adenoidectomies, tonsillectomies, ear tubes, but not tremendously like open heart surgery, not terrible types of big surgeries that we're doing. From the medication use, this is important to me in terms of how serious the conditions are. Mostly behavioral issues, gastrointestinal issues in terms of why we need to use medications. Sleep is an issue, and when sleep is better, behavior is better, learning is better. So many people are using melatonin and other sleep aids, which seem to be helpful. And then in terms of epilepsy medications, not a clear winner is what I have to say. Most people, if they're using medications, it's one medication, it's not a whole cocktail, but not a clear winner. And in a good way, it looks like multiple different medications are working. Okay. This is now some granular data, and I'm happy to talk to people offline, but in terms of what you're reporting with how your kids are doing with development, you saw some of a similar thing earlier. Age is on the x-axis, so kids, each dot is a different person. So kids are gaining skills over time. They are gaining, but they're gaining slower than their age neurotypical peers. And this is just showing various different dimensions, but this is for expressive language. They are gaining skills over time. When it comes to self-help and personal care skills, again, gaining skills over time as they're going forward. And with social development, also gaining skills over time. So that's the good news, although it's taking time to do it. This is now gross motor skills, or running, skipping, jumping, going up and down stairs, again, gaining skills over time. And in terms of behavior, some of the challenges for young children with behavior, issues in terms of problems being patient, being hyperactive, and then some of those same problems over time, but problems in terms of demands, frequent attention, and obsessions as well. So, with the interest of time, let me pause there, but to say one of the reasons why we need to do the natural history is we need to be able to know how much things are changing over time, so that without an intervention, what could we expect? And then with an intervention, how much does that change? Does it get even more better on top of how kids are normally developing? Does it plateau, or does it even cause problems? But we need to know that to be able to move forward. So, thank you.